The announcement of Olympia Medical Center's sale and closure came on New Year's Eve. Before the clock struck midnight, the community began mobilizing against it. City council members wrote letters, healthcare workers signed petitions, and union groups staged protests in the days and weeks that followed. By the end of January, the LA County Emergency Medical Services Agency had passed a resolution calling on officials to keep its doors open for at least another 6 months. Olympia Medical Center, which has served the Mid-Wilshire area since 1947, is slated to close Wednesday. The pending closure of the facility, which housed an emergency department and 6 intensive care beds, among other services, has prompted outrage and concern for myriad reasons. Nearly 40% of the hospital's patients are Black Americans, 63% are over the age of 60 and 90% are covered by Medicare and Medi-Cal. Many residents of the surrounding neighborhood have long relied on the hospital for their primary care. The hospital's operator, Irvine-based Alecto Healthcare Services, caught the community by surprise with Olympia's abrupt sale to UCLA Health, with some critics questioning why the company received more than $25 million in COVID-19 relief funds at a time it was planning to close the hospital. An Alecto representative said the decision to sell predated the pandemic. While the community sees the transaction as a betrayal of public trust for a much-needed resource, public policy experts said it's business as usual in the world of healthcare. For-profit hospitals have autonomy over what they're going to do and whether they're going to sell, said Joanne Spetz, director of the Philip R. Lee Institute for Health Policy Studies at UC San Francisco. Nobody can tell them they have to stay open, in the same way that nobody can tell a restaurant downtown when it closes that it has to stay open. Many details of the sale, including the purchase price, are not publicly available. A Times Public Records request for sales information from UCLA will not be answered until at least May 28, according to the university. UCLA Health, which took ownership of the property in January and is leasing it back to Alecto while it winds down services, said it provided the company with the ability to keep Olympia Medical Center's doors open long enough to help see the community through the pandemic. UCLA Health is exploring plans to turn the property into a mental health facility. Michael Sarrao, Alecto's executive vice president and general counsel, and Matt Williams, Olympia's chief executive, declined to comment about the transaction. Olympia's closure also reflects a pattern for the California hospital industry at large, which is undergoing a sustained era of mergers and acquisitions. Over the last few decades, there has been continuous consolidation in the healthcare industry, said Glenn Melnick, professor of health economics at the USC Saul Price School of Public Policy.